Hello and welcome, everybody. My name is Travis Miner, and on behalf of Open Door Education, I am super excited to introduce Dr. Kristina Pinto, who is here with us today to talk about neuropsychological evaluations. Thanks so much for being here.
Absolutely. Glad to talk to you.
Dr. Pinto earned her doctorate in human development and psychology from Harvard University and completed her clinical neuropsychology specialization at Suffolk University. And she's also a certified yoga teacher and has written and presented extensively on gender, culture, and mind-body health. Um, uh, Dr. Pinto, it's wonderful to get to talk with you and learn a little bit more about neuropsychological evaluations, which is a term I imagine a lot of parents and students have heard at some point. But maybe we could start with the basics. What is a neuropsych evaluation?
Yeah, it can seem kind of ambiguous and mysterious. So I like to think of a neuropsych evaluation as a clinical tool that's kind of like a psychological X-ray. And it's used for folks who have difficulties with thinking, functioning in daily life. And that can mean social functioning, emotional, academic, learning in their job. And it often involves a diagnosis that's going to help a person and their family with treatment, finding appropriate support, sometimes accommodations in school or the workplace, things like that.
Okay. And how long does a neuropsych evaluation take?
So the evaluation itself takes a few hours. The whole process spans a few weeks, but the evaluation itself will take a few hours. That includes an interview and the testing, obviously with breaks along the way. And and then it also includes a feedback appointment a few weeks later to review the results will be in a report that I provide to families.
Interesting. So it sounds like it's a really robust process. Um, what what might lead a family to seek out a neuropsych evaluation for their student in the first place?
Yeah, so oftentimes their student is having difficulty with learning in school, maybe some issues with attention, um, organization, procrastination, things like that, that are really getting in the way of their learning or their functioning in the day-to-day. They oftentimes are struggling with anxiety, depression, things like that. And parents want more information about what's going on and how they can help and support them. And then oftentimes parents have read or heard about specific diagnoses like ADHD or autism or learning disorders. And they'd like to know if their child meets the criteria for those disorders, again, to get supports and help for them.
Okay, so sometimes it may be a more wide open, we're trying to better understand how our student thinks and learns, and sometimes that people might come in with a very specific question they're trying to answer. Um, Interesting. What are like the first steps that someone might take if they fall into one of those camps?
Yeah, so the first step would be to reach out to me and then set up a call, basically a short call where we talk about what the concerns are, what's going on with the student at that time. And then we'll talk about whether neuropsych testing or an evaluation is appropriate at the time. And we'll kind of go from there. I'll send out a history form that the parent completes, oftentimes with the input from their student. And that history form I use to develop a series of a list of tests that I would give them, and then we kind of go from there.
And you mentioned tests, which is a it's I feel like it's a world I spend a lot of time in, but I think of a very specific type of test. I'm curious, what do the tests or the components of a neuropsych evaluation actually look like, or what sort of activities do they entail?
Yeah, so it kind of depends on what the concerns are that the family is coming in with. The word test always makes people a little anxious, but the tests are in large part different from what you might see, in school. The tests look at lots of different types of thinking, so verbal skills, visual spatial skills, attention, learning, memory, processing speed, stuff like that. The tests are actually quite short. They last, they take a few minutes. So someone might do, upwards of 12 to 15 tests during our time together. So they're pretty short tests. Oftentimes the tests start out easy and get harder as they go. And that's a way that we use to find a student's, sort of level of cognitive functioning. Some are talking, some are pencil and paper, lots of different things.
Is when these tests are sort of evaluated on the back end, does that factor in considerations of age, for example, or things like where somebody may be expected to be on or off track developmentally?
Absolutely, that's a really good question. So when I analyze the data, I analyze it in two ways. One is by comparing the students' performances on the tests relative to their aptitude. So some of the tests I give are to assess their aptitude. And the other way I evaluate their performances is relative to somebody their age, somebody in their grade, somebody of their gender, sometimes ethnicity, things like that, so that I can really compare them to someone who's similar.
Interesting. So once you've done that analysis, what sort of information does the family then actually receive? Like, what does a neuropsych evaluation include, and what happens with it after that?
Yeah. So after I analyze the data, I put it together in a report that usually takes 2 or 3 weeks after the testing for me to do that. And then we review the report in a feedback appointment. And that takes maybe 45 minutes to go over the results. So I'll go over students' strengths, their areas of difficulty, how those compare to each other, any relevant diagnoses, and then I spend a lot of time on the recommendations for what could come next in terms of treatment, school accommodations, lifestyle changes, things like that. And then I give the report to the families, and it belongs to them at that point.
Are are families required to then share that with the school that the student attends, or does that sometimes a decision made on a case by case basis?
It's entirely up to them. So a lot of times, a family will have a report and they'll decide oh, well, we don't want to give this information to a school, and that's their prerogative. There are times when they would like to share the report with a school in order to pursue accommodations, but they don't want some of the personal details from the child's background in there. And so
Sure.
we work together to edit the original report for one that's more appropriate for the school.
Interesting. And if I'm understanding correctly, it sounds like a family who, maybe based on what they've heard, read, and experienced, thinks that I think our student might have ADHD in some way, shape, or form. Going through the process of a full neuropsych evaluation could potentially result in a diagnosis that confirms for the family, like, yep, this is what's going on, or no, it isn't, but this is what we've learned or noticed.
Exactly. So, the diagnosis is possible. Obviously, it's not guaranteed because I don't know the child yet. But even if, the diagnosis, they don't meet criteria for the diagnosis, they're still obviously having some difficulties and concerns. And that's where the recommendations become very important, because there are numerous ways to address the kinds of difficulties someone with and without ADHD might be having. And so, we focus on steps they can take to feel better.
That I imagine that could be immensely helpful and validating for folks who are trying to figure out what's making things difficult at school, for example.
Yeah.
So what can't a neuropsych do? What are sort of the limits to the evaluation?
Good question. So, in addition to there being no guarantees about a diagnosis, a lot of folks rightfully are confused about who can write prescriptions and who can't, and what is a neuropsychologist. So I'm a clinical psychologist who specializes in neuropsych. I'm not a medical doctor, so while I can make recommendations about what folks might talk to their primary care or psychiatrist about in terms of medications, I don't prescribe medications. And so they would need to share the findings and their symptoms and concerns with a medical doctor pursue a medication.
Gotcha. And one of the ways that we here at Open Door encounter the conversation around neuropsych evaluations is most frequently when it comes to standardized tests, because maybe a student had a neuropsych evaluation when they were much younger and then had accommodations, no longer uses the accommodations, then they get to standardized tests and they're like, actually, the timing here is really tough, and I feel like those accommodations would be really helpful to me in this context. Um, how should families think about neuropsych evaluations, standardized testing, and sort of the college process in general?
Yeah, so, in terms of standardized testing in neuropsych, it's important to give enough time to have the evaluation prior to when you're planning to take the exam so that you have time to apply for the accommodations if the testing suggests that those are appropriate. And so, the neuropsych will use, the types of tests that the standardized test publishers or the boards will want to see, and will, in the recommendations, if appropriate, specify that the student qualifies for extra time of this much, 50% extra, 100% extra, and other accommodations like private testing room or things like that. And then the family would submit the report with their application for accommodations on standardized tests. And from there, the college board would reply with, whether or not they approve the accommodations.
I really appreciate that you mentioned leaving enough time for this, because we have encountered situations over the years where, yeah, the timeline for having a neuropsych evaluation done, receiving the report, coordinating with the college board. I mean, anytime you introduce a big bureaucracy into it, it's going to take a while. So yeah, if it sounds like families who are considering whether this is an appropriate step to take, sophomore year or earlier is a
Yeah.
good time to take action, as opposed to waiting and thinking, oh, we'll deal with it if it becomes a
Yeah.
problem.
I also think that, sometimes it's totally reasonable for a family to wait for a student to take the PSAT or the practice ACT, see how you do.
Mhm.
It's a lower stakes kind of test, and from there decide if a neuropsych is appropriate. As far as your question about, the college application process, I think neuropsych testing separate from standardized test accommodations can really help families figure out what the best fit is in terms of the school that their student will thrive at. It won't necessarily help a student get into the most elite school or their top choice school, but it can help with illuminating strengths and weaknesses and what might be a good fit.
Absolutely. I remember hearing a college counselor recommend also that students should have if it's been a long time since they had their testing done, have it done before they go off to college, because then their testing will be up to date, their accommodations will carry over into college, and just a prudent step when thinking about what does it look like for the student to move away from home and be
Yeah.
independently successful at college.
Yeah, transitioning to college is hard enough. So having this in place, particularly if you do have ADHD, you want to get started early because it might take a while for you to pull your things together to, meet with the disability office and pursue accommodations. So yeah, testing, in your junior or senior year should be sufficient for qualifying for accommodations once a student gets to school.
This is such helpful information. If families have additional questions or are thinking this may be something that we should pursue for our student, what's the best way for them to reach out?
Excellent question. So they can reach out through Open Door. I provide neuropsych evaluations through the Prism Therapy Collective. So that's another way to get in contact with me. And as always, with everything, Googling my name is a good way to find me.
Excellent. Thank you so much for your time, insight, and expertise today. It's wonderful to get to talk with you.
Absolutely. Anytime.